Welcome to the SCAGO Summit 2023. I hope everybody can hear me. My name is Stefan Branov, and I'm a registered social worker with the Hemoglobinopathy Lifespan Clinic at London Health Sciences Centre and Children's Hospital in London, Ontario, Canada. I'll be moderating today's session on the inpatient experience when accessing treatment, a conversation with patients with lived experiences of sickle cell disease. If you or your members of your network would like to refer back to the information shared in this session, a recording of today's session will be posted on our website, that's sicklecellanemia.ca, for viewing at your convenience. In our session, we will be hearing from two guest speakers who I will formally introduce shortly. Please visit the speaker page to learn more about them. Our agenda today will start with a few housekeeping rules, which will then be followed by our presentations and then a Q&A session. We do ask that you save your questions, your thoughts and concerns until the latter portion of the session where our guests will be able to answer questions individually. In terms of housekeeping and rules, we do ask that you respect the learning being done in this space by abiding by the following housekeeping rules. You'll notice your microphones have been disabled, and we ask that they remain disabled during the entirety of the presentation. And if you would like to ask a question, please do so by putting your questions in the chat in this Zoom or using the Q&A function on the app, or by raising your hand. And I will keep an eye on the prompts and will unmute you and prompt you to ask your question. Translation captioning is also provided for those who would like to hear this session in a different language. Please know that you can do that by clicking the show caption button at the bottom of the Zoom screen, and you can check the enable translation checkbox, and then you can choose the language that you prefer the caption to be translated in. And the session is being recorded, so that function will be active. We do ask that you use respectful language when in the chat or when asking a question. We also ask that you remain on topic and don't post other material that's unrelated to today's discussion topic. And we do reserve the right, or I should say SCAGO reserves the right, to pause the session to seek removal of participants who do not abide by these rules. We thank you for your understanding and agreement, and we hope for positive participation. I think we are ready to go. So our first speaker is Ms. Fitz-Ann Howell. She is a sickle cell warrior who has overcome all obstacles and continues to prove why sickle cell is not a burden. She is the co-owner of Divine Beauty Oasis, an up-and-coming spa in the GTA, where she is an esthetician, makeup artist, and massage therapist. When she is not helping the Black community look and feel great, she is advocating for those with sickle cell that need a voice. She carries out this commitment in her current role as co-chair of the Patient Advisory Council with SCAGO. Please join me in welcoming Ms. Fitz-Ann Howell.
Hello, everybody. Thank you, Stefan, for that welcome. I hope you're hearing me okay. And I apologize in advance because I live in Toronto, Ontario, Canada. There's construction everywhere. So if you can hear it, I do apologize. So as you said, my name is Fitz-Ann Howell. I have had sickle cell for over 30 years now. I know no one believes it when I say it. But today we'll be talking about my personal lived experience of inpatient experiences when accessing treatment. So for me, this presentation was a little bit difficult. So I took two aspects of the meaning of the topic. So not only actual care from healthcare providers and what I've experienced, but I also took a look at the medical interventions that we have available to us here in Canada as well. Next slide. So for me, accessing, for not only me, for everyone that has sickle cell, accessing treatment can be one of the most difficult decisions to make because of all of the connotations behind it, whether it's racist connotations, whether it's biases that you've experienced from nurses and doctors. Just making that decision to get care and to get treatment is a very big one. For me, I know the most impactful moment for me and my parents was my actual first crisis at 5 months old. We walked into an emergency room in a hospital closest to us, 5 minutes away, and they had no idea what to do with me. They've never seen sickle cell before. They had no idea what it looked like, what to do. And they put me in an ambulance and rushed me downtown to a children's hospital. And a Black nurse actually looked my mom in her face and told her, never bring her back here again because we won't be able to help her. And that was the defining moment of realizing that treatment for sickle cell, for not only the patients, but for the advocates as well, because for a nurse to say that to my mother is very difficult. And that was our turning point. So treatment from the medical standpoint, from that age until I turned maybe 12, was only penicillin. We saw nothing else to advocate for us from a medical standpoint. They only gave you penicillin. The care options for children are very slim to none. So if you have sickle cell, you completely understand what I mean. So treatment for adults, the treatments that are available for adults are in Canada, hydroxyurea, and that seems to be it. And I have a lot of friends who actually cannot take hydroxyurea just because of the multiple side effects. I have friends that have taken it 3-4 times and have lost their hair and have stomach issues, have liver problems just from taking the medication. So from a medical intervention standpoint, the decision to take treatment is a big one. For me to get on hydroxyurea, it took me and my parents 3-4 years to actually make that decision, just because of all the negatives that we heard about it as well. And it didn't help that I was in an environment, the hospitals that I was in were very slim to none, because none of them knew how to take care of people with sickle cell. None of them understood the connotations behind what we actually need. What we ask for is what we need, and what we look like may not be what we are going through. So just finding that balance and understanding that if I take this medication, I need a supportive team behind me. So that decision to actually start taking hydroxyurea, which again is one of the only medical interventions for sickle cell, especially here in Canada, was a big decision for me. Even just the decision to go to an emergency room, we can take a couple of hours being in pain to a couple of days being in pain before we actually decide that we're gonna go through with accessing treatment, just because of, like I said, all of the negatives that we've experienced, the mistreatment by nurses, doctors, even just the healthcare staff, the administrators at the front. They have their own biases. So the decision not only to get medical intervention, but also to receive care, it's the biggest part of being in crisis and being sick. It takes the biggest toll on your body as well. So when they tell you sickle cell is not just a physical disorder, it is a mental, emotional, spiritual disorder even, that's what they mean. Next slide. So I broke it down into a couple pieces. So going into emergency rooms, making that decision to even step foot into an emergency room to receive treatment is usually the end all be all for most of us, because that is where we get the most mistreatment. It doesn't matter if we go to I've had it where I go to my own hospital where my hematologists are, and I receive terrible treatment in the emergency room, and they have to call upstairs to verify that I'm even a patient, that I belong here, that they know who I am. And it feels like, it's gonna sound funny to say it, but it feels like trying to get into like a very exclusive party. and you don't have tickets, and you don't know who the promoters are, and you don't know how, you have no connections. It kind of feels like that all the time, just from a sickness standpoint. So as I said, even if it's your home hospital, receiving care in the emergency department is usually subpar. It's below means. I've had friends that have gone to emergency rooms and have laid on waiting room floors for 4 hours because they didn't look like they were in pain. So the staff thought they could wait, or they were given one dose of Dilaudid, which is pain medication, hydromorphone, any form of narcotic in a sense. And oh, they're just drug seeking, so we're only going to give them one, and we're only going to give them 1 milligram, which if you have sickle cell, 1 milligram of anything does absolutely nothing, right? So like I said, my first experience being in an emergency room, my parents got turned away. And luckily they were nice enough to put me in an ambulance and send me somewhere else, but just being there for a couple of hours and them doing absolutely nothing, them brushing my parents off, not giving them answers, it was less than. So that has always been the foundation of, am I going to receive treatment? Am I going to take myself to an emergency room? Is it worth it to receive care? And it's really sad to think about, because receiving care there should be no decision behind that. You're in pain, you're not feeling great, you receive care. But the fact that for sickle cell patients, you have to think about it, you have to process it, you have to clean your house and clean your room just to distract yourself, and you got to keep yourself organized at home while trying to manage your pain just so you don't have to go to an emergency room. It's really lackluster. It's very sad. So essentially, because of most emergency rooms, so for my first experience, back to that, I'm always going to refer to that because that was a turning point for both myself, my parents, even my siblings, on me receiving care. But because my parents went to a hospital where they lacked knowledge, they lacked resources, and none of the nurses or doctors were willing to try, it caused me to always have to go 45 minutes to an hour away from my home to receive care, because I know that's where I was accepted. That's where they could help me. And it's sad because on that 45-minute drive, you pass 6, 7 hospitals. So just to think that none of these places closer to you may have the resources or the knowledge, or even the nurses, doctors, the admin staff that are willing to listen to you, is really, really hard. So I've been to emergency rooms where they gave me medication that I was allergic to. I've been to emergency rooms where they didn't give me pain medication because they thought I was drug seeking. I've been to emergency rooms where they put me on a stretcher in the middle of a hallway and told me to wait for hours without being seen by a doctor, without getting any form of medical intervention. So just the emergency room standpoint alone, we could talk about this for hours, but I only have 15 minutes. So next slide, please. Then we have treatment once you've been admitted. So once you get through the obstacles of the emergency room and getting onto a floor, getting a bed onto a floor, this is supposed to be easier for us, but it's not always easier for us. So usually when you're admitted, depending on, I guess, the nurses and their attitude for that day and what they've been through for that day, there's a lack of rapport from most of the nurses. They may have gone through something, and it's very sad to say that I've seen a lot of nurses take out what they've been through that day on people with sickle cell. Not only myself, but on friends that I have, they will leave them in rooms. You press the call bell 12, 13 times, they won't come. And all you need is to get help going to the bathroom. You call the nurses for your second dose of something, and 3 hours later, the pain has gone from a 5 back to a 10 because you're not managed well. So it depends on the nurse's attitudes for that day. And it's very sad to say that their attitude will determine how long you stay in a ward at a hospital. It's determined on if you get treatment that day, because if they're in a bad mood, you may not get your next dose of anything for that day. And it's very, very sad that our lives are dependent on nurses and what they've been through. And even though, yes, being a nurse is very difficult, I have a lot of nurses that are friends as well. But taking out your biases and your attitudes and how you feel that day onto me, I can't even walk to the bathroom. I have no control over my body at this moment. It shouldn't be so. And it's really sad to say, but it should not be so. The worst experience that I would possibly say I had was transitioning from a child care facility to an adult care facility. Usually that happens when you're 18, they go through the full transition and you move forward. But for me, it happened at 21 because, again, lack of resources. And then there was no space in the adult care facilities for me. There was an issue with nurses and doctors and hematologists that were willing to take on new patients. So the transition there to go from a child facility, from a children's hospital to an adult hospital was even more stressful. And when you have sickle cell, you're trying to avoid as much stress as humanly possible. But when treatment facilities do the things that we're mentioning today, avoiding stress is just humanly not possible. So back to medication standpoint, when I was 13, I was taken off of penicillin, which is what they give you as a child. And I was not on no form of medical intervention until 21, 22, when they offered me hydroxyurea, which again was a 2-3 year decision for myself and my parents because of all of the negatives that we've heard. So the fact that there is such a lack of medical interventions for treatment as well, there's no other way to put it. It's just really sad. Next slide, please. So as for other treatment options, whether we are admitted, whether we are in the emergency department, or even just in to see our family doctors or hematologists, treatment, depending on where you go and who you are tied to as your family physician or your hematologist, can be slim to none. Because again, they're bringing in their biases. Most of them don't understand sickle cell, or they know what they've been told by people that have been nurses and doctors for 42 years. I've had a nurse, she was a nurse for 30 years and she couldn't get an IV on me. And she started to take that out on me because she knows what she's doing. And we weren't allowed to tell her what to do because she's been doing this forever. And she poked me 13 times. But because of her knowledge, we couldn't correct her and we couldn't assist her. Whereas a student that she was training that day was able to get it in one shot because she took the time to listen. So their biases, maybe their instructors who have been in the field for years have passed on those biases to them as well. The racial connotations. Sickle cell is only a Black disorder, which I really hate hearing and I really hate saying because I have friends who are not of African descent and have sickle cell. The biases of, oh, they're only here for drugs. No. Trust me, I take drugs every day. I take medication every single day. If I get a day where I don't have to take anything, it would be a great day. So all of those biases cause our care to be slim to none, if we get any at all, right? So as for treatment, like medical intervention, we've heard about bone marrow transplants and we've heard about stem cell research, and that, from what I understand, has gotten almost nowhere, especially in Canada. I know it's making strides in the US. I do have some American friends with sickle cell that have gone through it, and it's just a bigger headache for them as well. To have gotten on the list and to have gotten the treatment and to have gone through the process. So treatment from a medical standpoint, treatment from a healthcare standpoint, we're sitting on both sides of less than, essentially. So the fact that we have to not only have little to no medical interventions, but to also have to deal with the obstacle course of nurses, racial biases, doctors who don't know about sickle cell, who think they do, people that won't listen to us. I like to say it's a headache. I like to say we're playing a game of Mario Kart, but you can't win. You can't get to the end. So I really thank you all for listening. I hope that me speaking, as well as the other panelist, Gina, speaking, will help to turn some of these things around as well. Because all we want to do is advocate not only for ourselves, but for the babies that can't advocate for themselves, the voiceless, right? So I want to thank you guys for listening to my presentation, and I hope you have a wonderful rest of your day.
Thank you very much, Fitz-Ann, for sharing in your life experience and your testimony. And I'm grateful that you've chosen to use your experience to further advocate for all who are suffering from sickle cell disease and accessing care. And you are a part of the solution by starting the conversation and certainly improving the knowledge that everyone has, but by also being able to identify just things that are unacceptable, that no matter how hard a day is for someone, that doesn't excuse poor and unfair and unequal treatment. And, raising these things is very important. So I do thank you for highlighting these, the experiences that you've had. And I know we'll talk more about that when we come back to the question and answer period. But we want to transition to the second presentation now, and we want to welcome in our second speaker, Ms. Ogina Mitchell. She is a passionate advocate for justice and empowerment, graduating with honors in criminology and minors in women and gender studies, as well as youth and children's studies from Wilfrid Laurier University. Inspired by her battles with sickle cell disease, Ogina aims to help individuals and communities overcome challenges. She envisions a future where everyone thrives. Ogina is driven to pursue a master's in social work and a Juris Doctor to advance her mission. Alongside her academic pursuits, Ogina enjoys creative endeavors like candle making, makeup artistry, dance, hairstyling, and fashion design. She brings imaginative perspectives to consulting projects and actively seeks volunteer opportunities to impact her community positively. Please join me in welcoming Ms. Ogina Mitchell.
Hi, everyone. It's nice to be here today, and I just want to start by saying, thank you for having me. Today, I'll be talking about my personal experiences with hospital admissions and coming into contact with the healthcare system. And I just want to keep in mind that obviously everyone's experience is unique and different, but I hope that mine can provide some insight into how I was treated in the healthcare system. Next slide, please. So I just kind of want to start off with giving like a little bit more of a deep introduction. So I'm 25 years old and I went to Wilfrid Laurier University. I was born in the United States, New York to be exact. And then I relocated to the Kitchener-Waterloo region at the age of 2 with my mom. The community is very small. We only have 2 hospitals and one of them is a pediatric hospital. And it's not really a diverse community. So it definitely lacked exposure to different cultures and different races. And because of that, my mom and I really had to be very good at advocating for appropriate treatments and just appropriate care regarding like my sickle cell anemia. So I've experienced a lot of issues and mistreatment regarding like the healthcare system as well as like the educational system. Next slide, please. So because of my experiences regarding the hospital admission process, I like to kind of try my best to manage at home. I have a lot of anxiety about going towards like the hospital route because of just the negative experiences I had. So before I like go to the hospital, I try to manage at home. I set like a time limit I give myself, like, and I try and occupy myself at home. So within this time limit, I'll try to like take my PRN medication as well as hydrate, relax, and like not try to do too much. And I'd like to like set timers to remind myself to stay hydrated, as well as set timers to make sure I'm managing my pain medication well so that I can do my best to avoid going to like a severe crisis or needing to go to the hospital in general. And I just try my best to like monitor my process and see if I'm getting better. And I like to include like my support system in this. So just so that they know like, hey, this is where I'm at. I'm trying to do this. And if this doesn't work, then we need to start thinking about next steps. Next slide, please. So after this time period that I give myself, if I am not improving or if I'm like still in unbearable pain, I like to go to the hospital. I will either go to the hospital by like getting a drive from my support person. And when I mean support person, I just mean like a family member or a friend or a family member or a friend. So when I decide to go is either like my pain medications are not working, I can't really move, or I'm having trouble doing things on my own. And like, if my eyes continue to get like really yellow to a point where it's like abnormal, or I have chest pain or a fever, I go immediately. Next slide, please. So a little bit about my hospital experience. Depending on who is there, I've been going to a specific hospital in my area since I was 2. I do see the hematologist at Toronto General Hospital, but majority of my like admissions are here in my Kitchener-Waterloo area. So I go to one specific hospital since the age of 2. So depending on who's there, it gets a little bit complicated. So if there's individuals or nurses that kind of recognize me and kind of know who I am through my years of going there, it's a little bit smoother because they kind of have an idea of like what sickle cell is now and how to help me and how to help me get the care that I need. But if I am coming across individuals who I don't come across frequently, which is the majority of the time, it's a little bit unpredictable and a little bit more stressful. So if I'm going with my mom, we usually go to the emergency department, and then I have to go through triage like any other individual. And then I would kind of sit there and wait. So because of that process, I'm kind of really knowledgeable about the inner workings of the emergency department. So I know which days not to go, because if I go like on a Thursday, that's baby's night. And so majority of the time, babies are gonna take the first priority and they're gonna be seen, and we're gonna have to be waiting there 6+ hours in the emergency room with no pain meds, no treatment. Or if I go on a Friday, that's usually fracture day. So I'm going to be there for a while. So so I've become really knowledgeable about the ER just to kind of help smooth the process as much as possible. But if I am going through the ambulance, sometimes that does help because I'm able to go through triage a little bit quicker. And then as well as on the way in to the hospital, they usually give you pain meds treatment on the way. As well as if I'm going with my mom, I like to take pain meds before I go, because going to the ER, you're most likely you're not going to be able to get pain meds until the doctor sees you. And it's just sometimes a little bit more difficult to do it that way, because if you go there without taking pain meds, you're going to be sitting there 7+ hours in like severe crisis pain without being able to see a doctor. So how my emergency room set up is that it's usually 1 to 2 doctors working every day. And then we have a few nurses, but because they're kind of understaffed right now, they have a lot of burnout and they're very tired. And I guess that definitely plays a role to like how they treat us. I definitely feel like when the ER was kind of running smoothly and there was more staffing, like the staff would take their time and be a little bit more empathetic with you and kind of hear and try and meet you where you're at. But I think because of how the healthcare system is now in Canada, nurses barely, I don't want to say they are not empathetic, but it's hard for them to kind of meet you where you're at right now. I've had experiences where I've been in the ER and I've explained to them that I'm in pain, and nurses, and I can't walk at this point, and nurses will like leave pain medication across the room and then expect me to be able to get there when I'm not at that point where I can get it myself and help myself. I've had experiences where I've rang for pain medication and they'll come and try and do an assessment, and then they'll leave for 2 hours, and then they'll come back and say, hey, well, I'm going home, so you have to wait until shift change and you have to wait until the other nurse does rounds for you to get pain meds. I've had experiences where nurses come into my room and they're, touching a whole bunch of surfaces, and then I'll ask them kindly to change their gloves, and then they will kind of get defensive and then want to avoid me for like 6 hours and not come back into my room, no matter if I'm calling for help or yeah. Sorry, I'm also a little bit nervous. Always speaking about my like experiences gets me a little bit nervous because it's not really positive all the time, especially when it comes to interacting with like the ER and inpatient experiences. I do find that a lot of like staff and doctors, especially in my area, do not have like a good familiarity with sickle cell disease. So I also have to prepare myself when I'm going into these spaces to either have someone advocate for me if I'm unable to, or put myself in a space where I'm able to advocate in a way that they're able to understand my needs and kind of treatment that usually works for me. And I think this kind of plays into, it's kind of hard to always have to go to the hospital or interact with the healthcare experiences. And you have to kind of explain yourself or try and advocate when you're like an extreme amount of pain. I personally know when I'm not feeling the greatest and I'm in a lot of pain, I'm not really a happy camper. So it's really hard to kind of pause and just be like, hey, this is what works for me. And then, sometimes they kind of want to get defensive and be like, hey, this is what I think is important. This is what I think we should do. And like, I use morphine for my pain management. So whenever I go there, I always let the doctors know and say, hey, this is what I use. And sometimes they'll be like, no, I think Dilaudid would be more effective. And I'm like, well, no, I can't have Dilaudid. I'm allergic. So I need this. And I've actually had a like experience where a doctor gave me Dilaudid instead of, even though I had made it clear that morphine is my medication and it's a part of my treatment plan. So it gets kind of hectic. I also had like experiences where I'm going to the ER, I'm like throwing up and I still have to wait like 4+ hours, even though I'm telling the staff like, hey, I need help. Next slide, please. So I've also had experiences where, I would be admitted and I would, be in active pain, and I would have nurses come in and be like, hey, we are kind of short for rooms. We need this room. We need to move you somewhere else in the middle of a pain crisis. I think, sometimes because of the lack of information around sickle cell disease, it definitely puts a gap in terms of like having empathetic care for us. And I definitely think that it makes it really difficult for individuals wanting to go to the hospital and seek help. And especially like they are so understaffed sometimes that I like to bring a support person just to help me so I'm not calling the nurses all the time. But then sometimes they'll be like, no, you can't have a support person, which I think, just how the atmosphere is on the hospital right now, like having support persons are very important for, I feel like, anyone going to the hospital. So next slide, please. So this is kind of what I think needs to be changed. So I definitely think there needs to be more education towards like the emergency department staff. I definitely have had experiences where I'm going to the emergency room, and because I'm not like on the floor or overreacting, that they definitely have thought I was drug seeking. And I just think, after experiencing sickle cell for so long, I kind of know how to manage my pain, and I don't have to look like I'm in pain to be in pain. So I think they're always like kind of questioning, hey, because you're not acting this way, are you in pain? Or they're refusing to give drugs because, oh, you had, drugs 2 hours ago, how are you still in pain? And it's just kind of, I feel like, unempathetic, especially if I'm communicating and saying, hey, I usually take 10 milligram of morphine at home to help manage, and they want to start you with 5. Like, that's not going to work for me. That's barely going to scratch the surface. I definitely think we need to kind of encourage more of a environment in the emergency department where we can communicate our needs and our experiences without like having to feel shame or judge or like have a fear of stigma. I definitely feel like there's a lot of stigma, especially surrounding race, about when we are going into the hospital, and especially since this is a predominantly Black disease. I feel like that also puts like an obstacle in between patients getting appropriate treatment regarding sickle cell disease. I also think that it's important that we are able to have pain relief in a timely manner. Like I understand that, it's a busy world in the hospital, but I also think that, it becomes a little bit problematic when individuals with sickle cell disease are waiting like 6+ hours in the emergency department to see a doctor without receiving pain meds, or we're ringing the pain, we're ringing the health bell and waiting like 2+ hours for a nurse to come for us just to say, hey, I need pain meds, and then they come back another 2 hours with your pain meds. I also think it's very important that the hospital has more education and informative measures on infection prevention. And I find that I've had friends that have sickle cell disease that have gone to the hospital, and like the nurses weren't changing their gloves as frequently, and then that has caused them to get infections through their IVs. And make them stay longer. So I think that's very important that we're able to have like conversations with those coming into contact with our personal area, that we're able to ask them and let them know like, hey, I don't feel comfortable with you touching the desk and then coming to touch my IV without, changing your gloves. Yeah. So those are kind of the thoughts and opinions I have about what is kind of needed for the healthcare. But I also think, last thought here, that it is very important that we kind of start incorporating more of a care plan for individuals with sickle cell, so that, you know, it's a little bit more individualized. And so when you go to your hospital, you can say, hey, I have a care plan here. This is what happens when I come. I think that will help the transition between, you know, patients and the healthcare providers, and understanding and meeting us where we need to be. And that's something that we can also work on collectively with them, so that it gives us a chance to feel like we are involved in the decision making. But yeah, that's all I have for my presentation today. I'm sorry if I rambled a little bit, but thank you for having me, and thank you for listening.
Thank you very much for that presentation, Tina, and thank you for sharing in your personal experience. You highlight a number of tensions that currently exist in healthcare and in the different settings that patients with sickle cell disease may access care. And while many of those are true, they again don't excuse you know, the treatment that is received. And ultimately, I think as healthcare professionals, and I am part of that group, we have to remember that we are there for you. You are not there for us. And so by first seeing, validating, and listening to you is the most important thing. And that doesn't happen when all of these tensions, you know, surface and you encounter these challenges that aren't even specific to sickle cell disease, like proper hygiene and changing gloves and things of that sort. So there's a lot of work to do. And as you also highlighted, and Fitz-Ann did as well, raising awareness, growing the knowledge is very important. But again, I think as we transition into Q&A, I want to kind of highlight the challenge that it can be to communicate so clearly as you have today when you're in 10 to 15 out of 10 pain, and to do so clearly. So it's very hard to educate, advocate, ultimately communicate when you're in that space. So I hear that, and hopefully we can have a nice productive Q&A session here now. But again, I thank both you and Fitz-Ann for your presentation. And we'll turn it over here to the group and see if we have any questions. I think you can pose them here in Zoom, and I believe also on the app, in the Q&A portion there on the side of the screen. But we do have a few comments here. So the first one looks to have been shared during Fitz-Ann's presentation. It's more of a comment here, but it says, thanks for so much for sharing your experience. As clarification or correction, children with sickle cell disease are actually treated with hydroxyurea from infancy. So please feel free to follow up, Fitz-Ann, if I'm remembering incorrectly. I don't know whether you made that distinction as to whether it was treatment for all children or that's just what you received, but that is encouraging, and I do know that that is the approach now, but I don't know if you were referring to a time in the past.
I think for me personally, it wasn't offered to me in infancy. They automatically went straight to penicillin, which was like standard, I guess, in the 90s, because I'm old. And then hydroxyurea got introduced to me at like 21, 22, which was like 7 years ago. So I know that now it's more prevalent for like children, but for me personally, no, I didn't have that option. So thank you though.
Yeah, well, and thankfully we have transitioned to different treatment approaches, and certainly hydroxyurea is much more appropriate and beneficial for those who can take it. The next comment here was validation. You're doing great. Thanks for sharing. It's not easy to share, indeed. And I thank you both for sharing. You did wonderfully. And we do have a question here. I guess this can be posed to both of you. You can both take an opportunity to answer, but have you seen any improvement in emergency department care over the last few years? For instance, do they use standardized order tests? Also, would it be helpful to have a letter from your hematologist with your history and plan of care?
I guess I can start and take the lead on this question. I definitely think in my area, there has been a little bit of improvement, especially since as the community becomes more diverse, we're getting more individuals with sickle cell living in this area. So I think the emergency department is kind of having an idea of, hey, like we're getting more patients, so we need to kind of have a kind of process of admitting them and seeing them in the emergency department, as well as the hospital that I go to is the biggest one in my area. So I have been going there since I was 2. So I have always been trying to advocate, if that means even meeting with the administrators and saying, hey, like this is my experience and this was not okay. So I try my best whenever I had a bad experience to reach out and let them know, and hopefully that can help them improve for anyone else who comes into contact with this hospital. I have in the past had letters that, you know, my hematologist has written, and I'll just show them to the emergency department. And sometimes it does fast track going to see the doctor. But it's not always that easy. Sometimes you show the letter and say, hey, my hematologist told me to come here. I need to get a blood transfusion. We're not planning for an admission. I'm just here to get a quick tune-up. And then sometimes they're like, okay, well, you still have to go through triage. You still have to wait to see the doctor. You still have to. So I just think it's also like, depending on how the day is going, it's very unpredictable. As well as for a care plan, I recently was admitted like 2 months ago at my hospital, and I shared my experience, and I'm like, hey, like what I experienced was not okay. And I've been going here since I was 2. So they decided like, okay, let's make a care plan. And so right now I'm in the process of working with the administrators to have a care plan about whenever I go to the ER, what is kind of needed and how can they best support me. So that's why I'm huge on advocating, like, and, you know, touching base with people around, because they can provide help and maybe they just don't understand what was going on.
Yes, absolutely. And it's very helpful to have that information with you when it's hard to communicate or just to articulate your history and what care you have received. And I think it really is dependent on hospital and the community that you live in. You know, from your presentation, you mentioned moving and kind of encountering that change. Well, even within Canada, within Ontario, there are certainly more like bigger cities, like in the Toronto region, but there's also more isolated areas where they would, you know, you mentioned you have sickle cell disease and they won't know what you're talking about, even if you present that letter. But so the education piece is very important, but as was mentioned in the question, the idea of having a card, a fever card, those are things that can be handed out. I know in our clinic we do, and it kind of outlines not only disease, but also treatment and preventions or steps to take. So things like that are helpful for sure. There was a follow-up comment here as well. Really appreciate you sharing your experience. It is very motivational for me. I wonder if it would be helpful to have some kind of identification card listing the quality standards for ED and your diagnoses to help advocate for care. Do either of you have those? Either Gina or Fitz-Ann?
I did make one when I was transitioning from pediatric care to adult care. I think Sick Kids has a website where you can go on and you just put in the information, like your standard, like baseline for your hemoglobin and the medications you take, where you experience your crises, and you can just kind of provide that whenever you go to the hospital. I know that was very helpful for me, like when I was going to school, because when I was registering with my accommodation center, I would just say, hey, this is kind of what happens. And it was very informational, like for the teachers and informative. But I just feel like when you go to the hospital, you can provide letters, identification, and I feel like they're gonna do what they feel like is best anyway. So I feel like it's best to kind of be able to advocate during those situations and try to have open communication and work together. Um, that's what I kind of feel like. But I mean, it also depends on the hospital you go to and um, the staff that you're interacting with.
Certainly. Yes, thank you. You'll see the poll screen may have just popped up. I asked you to please complete those in the background, but we have another question here for Fitz-Ann. That's okay. What do you hope for the future of sickle cell disease and the treatments that come with it, from the medicinal and treatment intervention aspect, but also from the support you receive from your healthcare professionals?
I think for myself, and I'm guessing that Gina would say the same, that it all starts with like a change in not only the treatment aspect, but in the attitudes of the nurses and the doctors. It starts with a change in the approach from the front desk admission staff that you walk into the emergency room to who wheels you upstairs when you're admitted, kind of thing. It has to change on all levels. So they have to get rid of the biases. They have to get rid of the racism. They have to get rid of the stigmas of, oh, we're just seeking drugs. And they have to get rid of whatever they're standing behind as their guard, essentially. Because even like from an infection standpoint that Gina was talking about, I spent an extra 2 weeks in the hospital because the doctor thought he knew better than me, because he gave me an infection. So I completely understand where you're coming from. I think all of those need to just change. And the only way that they change is when people are willing to listen. So, for example, the emergency department question about has there been change in the last couple of years? I've seen a little bit of a change because I know I go to TGH, which is also my hospital where my hematologists are. So the emergency department will always be the emergency department, regardless of if you go to your home hospital, if you go somewhere else, it's just going to be emerge. But because they have tried to set in place like this, not even like care plans, but these are our patients, treat them like people. So there's been a little bit of a change, but it's not going to completely change until people are willing to close your mouth, open your ears. You got 2 ears, 1 mouth. Talk less than you listen, right? Because I only know what works for me the same way Gina only knows what works for her, right? You can't give me what works for her, and I can't give her what works for me just because we all have sickle cell. As many of us are there, we're all different. The same way your eye color is different, the same way your skin tone might be shade off, the same thing, we're all different, right? So until people are willing to change on that standpoint, then we won't see a change. And then from like a medicinal standpoint, until we're willing to, I know they're trying to find things that work for everybody. And again, you can't look at it from an everybody standpoint. And it's sad to say, it sucks to say, like, it'd be great if we could all just pop Skittles and it works for her and it works for me, but it doesn't work that way. And I think that was when I was growing up and they started introducing hydroxyurea, that's where all the negative came from. Everybody's like, oh, it's supposed to be magical and work for everybody. And I have friends that are like, yeah, I lost my hair. I'm wearing wigs now because my hair won't grow back, or my liver won't function the way it needs to because of hydroxyurea. I think when it comes to a point where they're like, okay, this is not standard for everybody, we need 3 or 4 options that is universal, that can work for everybody. And if this one doesn't work, you have option B. So that from a medicinal standpoint would be great. But like I said, until people are willing to listen, none of those things can change.
Yes, that's very true. You're right. We can't learn with our mouths open. We can't hear with our mouths open, and that is where, in fact, it starts. And I hope that finds its way into all of the settings, whether it be emerge or the clinics or inpatient, that we are all willing to listen. And professional standpoint. I know that's a very complex area, and I hope that research continues and advocacy continues to promote access to different therapies that are available. And again, this is where it starts, having the conversation and acknowledging that there is a gap and problem, and we move from there. So thank you very much for that response, and thank you, Gina, as well, for your responses and your presentation. I do believe we are right at our time limit here. So I do want to thank everyone for joining today, for listening, and for participating. And I want to encourage everyone who is still here in this presentation to join one of the simultaneous tracks that's going on, and we'll start at about 1:20. So it looks like there is a bit of a break, but there is a clinical track 2 and an advocacy track 2 and a psychosocial track 2. They're all going to be starting in about 35 minutes. So again, I thank you all for being here today, and thank you to our presenters. Hope you all enjoy the rest of the conference.